Okay, we're going to be doing muscle stripping now again, but we're going to be in the prone position, and I'm going to show you guys how to do muscle belly stripping to the hamstrings and the gastrocs, okay? So I'm not going to go over everything like I did with the deltoid, but if we were doing muscle stripping to the hamstrings, we would have to warm up the glutes first, we would have to warm up the calf, and then we're going to apply the stripping technique to the hamstrings here, okay? So if we're muscle belly stripping the hamstrings, we have to warm up the glute first and also the calf, okay? So I'm going to do biceps femoris because it's on the outside. This patient, his leg to my hand ratio is pretty good, so I think I'm going to use my knuckles to do some stripping. I think I'm going to be able to use my biomechanics to do some really, really nice, deep, specific work. I'm actually going to go from least stable to most stable in this position because he's on the table. Like it's not as important as if it was the arm and the position of the shoulder. So I'm actually going to start here and I'm going to go here, but I could also start here and go here, okay? So obviously we're not going to use hip extension. I'm going to use knee flexion and knee extension. That's going to be my assessment for this. We don't have to worry about them doing extension of their hip, okay? So any pain? Oh, it's really, really painful. Oh, it's really restricted. Okay, totally. Oh my God, muscle stripping really indicated here, okay? So I would have warmed up with all of my techniques, warmed up specifically here. I'm gonna go right into the stripping though, okay? So I know the muscle really good. I know that the tendon, the musculotendinous junction is right there. So I'm gonna get my patient to push and relax. My knuckles go up. I'm gonna reinforce and I'm gonna go really deep. I'm gonna follow that nice, slow, specific direction all the way to the ischial tuberosity. What number would you give that, Adam?
4.
It's a 4. Okay, are you okay with that?
Yes.
Okay, push again. My knuckles go up. I'm going really deep, really slow, and really specific. My wrist is in a nice neutral position. This looks like it's tight, but my knuckles aren't actually really tight. They're quite relaxed, and this doesn't feel like it's stressing my hand out at all. Okay, and I'm going to gently release at the end. I'm not pulling off the body. That's not going to feel good for our patient. I think one more pass, because this is a bit of a thicker muscle. I have to fire that muscle off every time. I need to make sure I'm on that contractile tissue. And I'm going nice and slow. Slow, slow, slow. And I'm going to release, okay? I'm going to do a bit of clearing in that area. Do I move on? No, I don't know if I achieved my goal yet, okay? So I have to go back into that assessment. Oh, way more range of motion, less pain, totally feeling less pain. I achieved my goal, so now I can move on. Okay, so then I would work my way out, I would do all my techniques, I would do FLRs of the whole leg, and that would be muscle stripping of the biceps femoris of the hamstrings, okay? I'm also gonna show you guys on the gastrocs here, okay? So we have the medial and the lateral heads. We can strip each head, but we wanna be really cautious of our pressure because lots of people have really, really tight calves. So I'm not gonna be starting super deep with my stripping application. I might actually start with reinforced fingertips, and then as the pain decreases, I might move into knuckles, okay? So with this one, we're just gonna get our patient to point their toe. Okay, so we see how that fires off the gastrocs. We actually have a really nice gastrocs here, so push here. So muscle belly, muscle belly, muscle belly, muscle belly. Now it is tendon here, okay? So I'm really gonna be focusing my muscle stripping right here. I can actually really see where that transition happens here, okay? So gently relax. Okay, so I think I'm gonna go from here to here, okay? So obviously I would have done all my warm-up techniques, but for demo purposes I'm not. I'm gonna get him to push here. Sometimes if I create a bit of resistance or I just tell my patient to point their toe, my knuckle goes up, totally let go. I'm gonna start a little bit gentler. What number would you give that?
3.
It's a 3, okay. And I'm gonna go, go, go. And I feel that junction and I'm just gonna gently release and come off, okay? And push again and relax. Now I might go just a little bit deeper. My thumb is relaxed, my fingers are relaxed, my wrist is in a neutral position. I'm using my body to create the pressure here. And what number would you give that one? Okay, now that one's a 4. Okay, are you okay with that? Okay. And I'm gonna gently release, okay? I didn't do my range of motion assessment before that one, so I'm just gonna do it right now. I can do dorsiflexion and plantar flexion. I can also do knee flexion, but I'm really gonna focus on the plantar and dorsiflexion for the gastrocs, okay? So before it was restricted, that was my indication. I do my muscle stripping, less pain, more range of motion. I've achieved my goals and I can move on. Maybe now I wanna strip the medial aspect and then move on from the whole muscle. Make sure I do clearing, I do all my techniques, and I do FRs with the entire leg to finish.